Content warning. Please note that this episode discusses mental health cases and experiences shared by Dr. Dorothy that may be disturbing or unsettling to some listeners. We advise listener discretion and encourage those who may be sensitive to such topics to consider their comfort levels before proceeding with this episode. If you find yourself feeling uncomfortable or distressed, we recommend pausing the episode and seeking support from a mental health professional. Thank you for being so understanding and take care while listening. Welcome to the Holistic Counselor Podcast, where we explore mental health, challenge conventional norms, and embrace holistic healing practices. In this episode, I am joined by a dynamic BIPOC mental health professional who brings a wealth of experience and insight to the conversation. Thank you for listening. Welcome, God's masterpiece. As you tune in today, I want you to remember the reason behind the name I've given you. You are, indeed, a work of art, carefully crafted by the hands of our Creator. In today's episode, I am thrilled to introduce a very special guest, Dr. Dorothy, say your last name?
Chatelier-Orelus.
Chatelier-Orelus.
Yeah, you got it.
Dr. Dorothy is a doctorally prepared, board-certified family nurse practitioner and psychiatric mental health nurse practitioner offering comprehensive, holistic mental health services to individuals of all ages. What sets Dr. Dorothy apart is her unique approach to mental health treatment, which seamlessly blends holistic care with a strong foundation in faith. Dr. Dorothy recognizes that true healing is a multifaceted process, addressing not just the mind, but also the body, spirit, and environment. This holistic perspective is a rarity in the westernized mental health field, making her work all the more valuable as she is a woman of color, just like me. Our paths crossed through the Christian Mental Health Professionals WhatsApp group that originated in Broward. After engaging in a profound conversation with Dr. Dorothy one evening, I discovered that her approach aligns closely with that of Dr. Daniel Amen, a pioneer in brain health. This resonated deeply with me, as I too share this perspective. It was then that I knew I had to invite her to be a guest on my show. So join me today as we dive into the world of holistic, faith-based mental health care with the incredible Dr. Dorothy Chatelier-Orelus. Say it again.
Chatelier-Orelus.
It's so beautiful how you say it. Chatelier-Orelus. Thank you for being here.
Oh, it's my pleasure, Diane.
So tell us a little bit about your personal story in terms of what led you to be in this profession that you're in today.
Okay. First of all, I've always wanted to be in the medical field since I could remember. As a child, I wanted to be a doctor. Okay. However, coming from Haiti, when we came here, my parents wanted me to start working right away, earn some money. However, I did not want to veer away from my dream of being a doctor, so I chose nursing. And I've been a nurse for the past 19 years, and I do not regret it at all. I love what I do.
When did you come to America? And did you come to Florida, or where did you go?
Yeah, I've always been in Florida.
Okay.
So
how old were you when you came here?
17.
Oh, okay. So you grew up in Haiti.
Yeah.
Oh, wow. Okay. And then you came to which county? Broward, Dade?
No, Dade.
Dade County.
Yeah,
okay.
Yeah.
So
Actually, I attended North Miami Beach Senior High. I only did my senior year there and then went to college after.
Did you speak English when you came here?
Yeah.
Oh, okay.
Because we've been coming since we were little kids.
Okay.
We vacation here all the time. We just decided to stay in 97?
Oh,
Yeah.
okay. All right. So I was wondering, because that would be hard coming here at 17 and not knowing the language and being thrown into a Dade County public school. Ooh, talk about trauma. Okay. All right. So, and then why psychiatry?
Why psychiatry? To be honest, I started as a family nurse practitioner, right? I loved it. However, I always felt there was something missing. Even when I work as a registered nurse on the floor, for some reason, I was always drawn to the people with some mental illness. For example, the nurses would be like, give this one to Dorothy. I don't want to deal with this veterans. Or there's always, for some reason, I would naturally gravitate toward those with behavioral issues. after I earned my family nurse practitioner degree, I felt I enjoyed it, but there was something missing. So I decided to continue with psychiatry, and I can tell you, I have been so happy. My very first job as a psychiatric nurse practitioner was working at Dade Correctional Facility.
Wow.
A prison.
Wow.
That was my best job.
Wow. Why?
It allowed me to discover me. One of the issues I had was that I'm claustrophobic.
Wow.
Right?
Oh, gosh.
Right?
Oh,
Yeah.
I
And
can
then
imagine.
working in a prison where everything is closed and there's no window. There's yeah.
You just gave me goosebumps. I have I'm like,
And it was the greatest experience because I was able to see these people not as the crime that they committed. And you do know how much that is. As a mother, I'm taking care of people that have done, not wanting to say it, but I have done some outrageous things.
Yes.
And I was able to detach myself, the mother who I was, the wife, the woman that I was. I detached that to be the psychiatric provider that they needed.
Wow. Wow. Okay. I want to get into that for a second then, because that is so important in our field, because a lot of us come into the field working our stuff out. That's why we are attracted to it, right? Like, I know, okay, maybe I'm just speaking for myself then, because I know I went into the field because of my background, what's happened to me, what's happened in my family, the question, why would someone behave that way? Why would someone hurt someone? Why would someone hurt themselves? Why would, right? And so for you to say that you detached, like, and was able to function in that career, it's Dade County. Okay. Anyone listening outside of Florida or whatever, I mean, Dade County is Miami-Dade, right? Miami. We get from everywhere, from all over the world. I mean, this is South Florida. South Florida should be its own state, first of all.
I think so too.
Right? and it's just so, I love it. I love, because I've learned a lot here too. But when you were dealing with these human beings, because they're still human, even though they might have done inhuman things, right? Inhumane and animalistic things. What did you see? What was the biggest lesson you learned besides confronting your fear of being in enclosed spaces? Like, that is brave. Like
12 hours a day.
Oh my word. Okay. I mean, like, can you share maybe one case that you really were like, wow, that made you see psychiatric situations in a different light? Because you're holistic now. And I'm sure over there it was more of like diagnose, right?
And medicate.
Yeah. And not get to the core, because jail's supposed to be a rehabilitation. That's what I've learned in a system, but I also, because what I did working with teenagers, I had to learn the whole school to prison pipeline thing. Ooh, and that's a whole nother podcast. But because I have that understanding, I was realizing like, oh my gosh, like this is because I worked in the Broward County school system for quite most of my entire career, actually, like, you know, in nonprofits and alternative schools. So alternative schools turn into the prisons.
Yeah.
Right. Unfortunately. So tell me, can you share a case or something like that?
First of all, I want to add this, Diana, being trained as a registered nurse really helped me to do this because it didn't happen overnight.
Okay.
Right? As a nurse, as a registered nurse, when you're taking care of someone, you have to learn how to detach yourself from their disease, their sickness. People die, right? And then in any given day, you might have 2 patients dying, or in a given week, you might have 2-3 patients dying.
Oh my gosh.
What do you do, right? So I have learned that from my experience working as a registered nurse. However, when I got to the prison, that I had to take it to a whole other level, because at this point, it wasn't just someone dying. It was someone who was serving a life sentence because they killed 15 people. They raped a bunch of children, right? Yeah. So sitting in front of that person and not showing any fear, and that was another thing, is that there wasn't any fear. Right. I walked among them. We were not supposed to shake hands. There were no ever any physical interaction. So they're not supposed to shake my hand, and I know I'm not supposed to shake their hand. However, I would sit in a room just like this when I'm sitting with you and talking to them. Right. And as they open up and you're hearing the things that they have gone through,
Yeah.
understand, I never excuse what they did.
Exactly.
Right?
Right.
However, I understood them.
Mm-hmm.
Right? One of the, every single time I think about it, it kind of brings shivers to my spine, because this guy, he was about 17 years old. He's been abused by his father in all kind of ways. And the way he murdered his father was very gruesome. One of the things I never did, as I'm taking care of my patients, I never dig into their files to find out what they did.
Right.
Because I felt if I don't know, then I can be partial. I can really take care of them.
Non-judgmental, which us in the mental health field is supposed to be non-judgmental.
Exactly.
Yeah.
So that was my thing. I don't want to know what you did. However, this guy was so sick that when we would do multidisciplinary meetings, so his background came about, and when I learned it, I was like shocked.
Which would be vicarious trauma.
Yes.
Right? Or compassion fatigue.
But the reason why, let me just, because I don't want to go to what he did, but the reason why he was in my unit, because I was actually in the crisis unit, which was the toughest unit to be in.
Right.
And the reason why we had him in crisis is that every single year around the time he murdered his father, he stops eating. Because the way he murdered his father is that he ate his heart. I am so sorry to just picture that.
Oh, gosh.
Right?
Oh, yeah.
So every single year around the month, he stops eating and he loses a tremendous amount of weight. So we have to give him IV hydration, and it's every single year, right? So when I understood what happened, I was more able to help him.
Right.
I mean, I'm not saying that by the time I left there, he was 100%.
Right.
But the idea is that the team understood exactly what they were working with.
Yeah.
He wasn't an animal. He wasn't the devil. He was a sick man.
Yeah.
And
so that goes into, now I'm just going to go to this area of how people, I mean, you have to, I think, to be called into this kind of field, because like you said, like, I know there's going to be people out there that be like, good, he should die. Why are you trying to save a murderer? Like, right. And that right there, it's like, I get it. I understand that side as well, but we are hired to do this profession.
Yep.
And in doing our job, our work, we have to understand when the human is in front of us, how to separate. That's the detachment. And a woman of faith, okay, because you've been a woman of faith for a long time.
My entire life.
Your entire life, okay. And going in there, or going into, say, the church, like, how do you talk to people? I'm trying to be delicate, as you can see, just because I get it. We have different denominations with different views on who Satan is and who Jesus is and who God is. Now that I've, have my own private practice as a Christian integrative therapist, I didn't have that in the secular world. Okay. I didn't have because I wasn't allowed to talk about Jesus at all. I just represented him with my work, how I treated other humans. But now that I have open doors for people from churches from all denominations and walks of life. Let me tell you, from Catholicism to Presbyterian to,
Pentecostal.
Yes. Yeah. The highly charismatic to, like, what are you doing? You're everyone's chosen. Like, it's, so I had to be like, oh my gosh, like, I didn't see it that way. So I had to learn a lot of lessons. What do you say about that client, that person you were helping, or a lot of people that you helped in the prison system, that's just the devil and that's Satan?
You know what, Diana, it's interesting that those patients, when I was looking at them, it wasn't just, okay, this person is possessed and it's the devil and there's no redemption for them. And that is why I love Christ so much. I love my God so much, because even someone like that can be redeemed, right? And the prison system, I wasn't allowed to say that.
No.
I'm not allowed to say that. However, some of them would tell me, is there a chance for me? Do you see? And as they say that, I couldn't help myself to say that, yes, there is a place for you at the cross. However you want to take it, however, whether I get called in the office after that, however, they had to know that there is still a place. It doesn't matter what you do. There is a place for you at the cross.
Yeah. I mean, that was when Jesus was hanging there, right? I mean, that's the story of is it the two thieves? Right? Yeah. I mean, even at that last second, he says, "Oh, you're going to be with me."
And I think that's what really helped me do the thing that I did there, being able to work and not afraid of the patients I was seeing.
Yeah.
And they respected me for that. I mean, did I see some crazy stuff? Oh yeah. I don't think I'm ever going to see these things anymore in my entire career for those 3 years I spent there. Right. Sometimes when I'm joking with people, I said, yeah, I spent 3 years in prison.
I love that. It really was.
So I would tell them, yeah, I'm very tough. I spent 3 years in prison.
Wow. Yeah. That must have, okay. So let's talk about the incoming interns that are listening, or people that are coming into our field. What would you say to them? Because we all have to start in the, I hate to say it like that, in those areas, like the community mental health, the alternative schools, the places that are desperate for help because nobody wants to deal with these kinds of clients. So that's where most interns end up because that's their first job. You have to get some kind. And to me, I loved it because that's where I got my true experience, right? Yeah. You see everything. I'm saying everything. Textbook cases. I mean, even not textbook cases, some stuff that I saw in alternative schools, because that's the younger version of what you were probably seeing before they end up there. Not all kids, but what would you say to the intern right now? What would be a beneficial statement or encouragement or resource for them to get through it without the fear? Because that's it. You're eager. I mean, do you remember the days when you first got out and you're eager and you have all this book knowledge in your head, and that DSM, ooh, when they told me that was my Bible and I argued, I'm like, no, but this is my Bible. No, you're becoming a therapist. The DSM, I think it was 3 TR was the DSM when I graduated. What would you say to them?
I think as a new provider, you first of all need to know yourself, right? Because I feel you can easily get lost in everything that you're seeing, that you're dealing with, if you're not comfortable with who you are, right? Okay. When I first, like I told you, it was my first job right out of psych school. And the one thing that I understood, I'm not going to tell you the very first few months were easy, because there are times I'm like, what do I say? What do I do?
Exactly.
However, over time, I got to understand that the most important thing for me was to know who I am.
Okay.
Right? Once you're comfortable in who you are, then it's easier to help people. But if you're just as confused as they are, there's going to be some challenge. Right? Additionally, I think we need to be this is South Florida, right? If someone is listening from South Florida, you need to be culturally competent in your care.
Oh, please. Yeah.
Right?
Okay. Let's go in there.
Because an Hispanic patient will be treated differently when I mean differently, as far as understanding the culture from a Haitian person.
Yes.
Right?
Yes.
Because I would have Haitian patient coming to me and telling me, oh, this is a spirit, or this is a loi. Loi, it's like a from the voodoo belief in the Haitian culture. And they'll come with something like that. And now, what do I answer to this? Do I run and say, well, no, it's not that?
Oh, no. Or diagnose them. Guess what? Schizophrenia.
Schizophrenia. Exactly.
That's the first thing that I've heard. And I'm like, wait, no, you don't understand the culture. Yeah. It goes straight to schizophrenia or some kind of,
psychosis, something, or they're seeing things, it's hallucinations.
Yes.
So when you are in that world, right, you can see how easily you can get lost because you're trying to help this person understand what's going on with them. You're trying to make them see where there is some trauma in the back of the way you're responding right now is because of this and this and that.
Right.
So if you're not culturally competent, if you're not comfortable with yourself, I think it could be disastrous.
Yeah.
Right?
Right.
So I think for new providers getting into this field is be comfortable with yourself. Take time for yourself. That's another thing, right?
Yes.
Self-care is not selfish.
That's right.
You need to stop and refuel.
Yes.
Because this will suck every single life out of you. And especially some people, the new people, when they come in, they want to give everything.
They're on fire.
They're on fire. I'm here to serve. I'm here to help. Or this patient is going to walk out of here being well. And it doesn't work like that.
No.
Right? Yeah. I remember one of my first patient who, he almost died because he cut himself, right? After I've been working with him for weeks. He was in our CSI unit, CSU unit. And
what is CSU for the listener that doesn't know what that is?
Crisis something unit.
Crisis. I don't know. I never worked with them.
It's been a few years since I left.
Okay.
But it's actually the most acute unit that we have before we transfer them out to hospital.
Oh, okay.
Usually it's for people that have tried to hurt themselves, commit suicide, self-harm, and all that.
Okay.
But this guy did he cut his, let me just be straight with it. He just cut his jugular.
Oh, gosh.
While he was under our care in CSI, right? CSU. I'm sorry. So he started bleeding heavily. Yeah. So, of course, the guard called me in. And nurse. I'm seeing this guy, blood all over the place. And I'm thinking, I worked with him yesterday. He was well. Gosh. He was okay. He's taking the medication. The mental health therapist saw him. Case manager saw him. What happened?
Yeah.
So in that moment, I started feeling guilty. Maybe I could have done more. Maybe I could have done this. And I'm having the guards looking at me going, well, I told you guys this is not, that was not going to help him. All this talking you guys are doing, we're not going to help him. So in a way, I'm thinking, oh, crap, I did something.
That's okay. You said crap. You didn't say, well, I won't mango this.
So I had to really understand that it wasn't me. That was a sick person I'm taking care of. And this could have happened.
Yeah, that's the thing. That's what interns need to understand, because you go in there thinking you're saving the world. But we need to remember one thing. There's only one savior of the world.
Amen. Yes.
One.
Yes.
That's it. Jesus Christ. And that is where my faith really played in. And if you don't have faith, I'm sorry. Like, I don't know what to say to the person that's listening. Find some. I don't know. But to me, that's how I got through the alternative school, what I saw. I mean, these were kids too. When you see 8, 9, 10-year-olds wanting to kill themselves, or they're trying to kill their mothers, or that's harsh when you're working with children in an alternative school like that. I want to go back to the cultural competency though, because I saw that a lot, and I was the minority, with the mental health professionals. When I look around, and it's not a racist thing, okay? Because when I'm about to say the word white, because nowadays it's but it's just understanding. I was one of the very few brown people in the field at that time, and I'm like, no, you don't understand. That's Santeria. Oh no, you don't understand. That's voodoo. I understood it because my grandma was a Santeria medium, and I grew up in that, so I got it. But when they're talking about the shadow following them or something Or I had a case where I had a student who was so freaked out, paranoid, because grandma in Haiti was her mom made her take the hair, send it back to grandma to do some voodoo magic on her. And she was so freaked out. It took her, to get her out of that anxiety without confronting her belief in that manner. So the cultural competency of the Caribbean, understanding Caribbean culture or other cultures, that are out there. I had a Hebrew nationalist. I forgot. And the only reason he would talk to me was because I was half Puerto Rican. Black Hebrew. It was a black Hebrew. Well, and they believe they're the chosen ones. You know what I'm, okay. And so that's what I'm saying. Like, if you are a practitioner of, even if you've been doing this for a long time and you don't understand what I'm talking about, then you need to start understanding.
Sure.
Are you a qualified supervisor or no? Okay. I'm wondering, because to me, what I think is super important for anyone new in this field or anyone that's not new and wants to understand the BIPOC culture, which I have a podcast on that, Black, Indigenous people of color. This is not political. I just have to say that because anytime I say that word, people get freaked out sometimes. Sometimes they don't, but sometimes they do. Is to hire someone like a mentor or I'm a qualified supervisor. Even if you have a qualified supervisor at your place. Yeah. And then you can have two supervisors, one that's teaching you the cultural competency if your supervisor doesn't understand that. So tell me what you think about the DSM or someone that's stuck in diagnoses or labels.
Okay, here's my thing on that. First of all, I want to say something. I do not want to think anybody to think that I'm hurting their feelings or I'm saying things that are inappropriate, right? However, the one thing I've noticed is that people have used the DSM-5, well, now we're using the DSM-5, they've personalized the DSM-5, right? In a way that they look at those characteristics, 1, 2, 3, 4, 5, and then, oh yeah, you have depression.
Right.
This patient comes out and thinking, oh, my depression. Now they start using words such as, oh, my depression made me do this. My ADHD made me do this, right? So their diagnosis unfortunately become part of who they are. Right. They cannot detach themselves from what's going on. You're going through a disease process, and this is what that is. Right. It doesn't necessarily mean this is who you are. But to answer what you just said about this DSM-5, yes, I do use it, and I do believe it's needed. Because if we don't have that guide, you and I would really know how to approach, scientifically how to take care of our patients.
It gives us boundaries. I agree. And it gives us the paycheck because insurance companies need a freaking diagnosis. Sorry, I just said freaking.
Between you and I don't know what's gonna be said today. So yes, I do use it. However, given that I'm a holistic provider, I go a little bit deeper than that. Okay. It's not just, okay, I'm seeing dig fast and boom, I drop a diagnosis. Yes, it's going to give me my diagnosis, but at the same time, there are other things I'm going to be working with my patients on. Okay. It's not just going to be once I see that, whether it's depression or whether it's anxiety, whether it's bipolar mania, bipolar depression, and I'm throwing a medication at you, which I have done at the jail. And I know that doesn't really work. Right. However, yes, I'm going to be using the medication. However, I'm going to also tell you about, let's take care of your health. Let's take care of your body. Are you eating well? Are you exercising? Are you sleeping well? How are you in your relationship? How are you at work? Right? So you have to see everything around the environment of that person. That is why holistic healing is mind, right? Yes. Body, health, and environment, right? So, and spirit, I forgot that part. So when I'm talking to my patient, it's not as if their brain exists outside of their body, right? Like I diagnose the brain and then that brain is going to do its own thing and the body is doing its own thing. No, I've understood that everything goes together. So if I'm giving you a medication, I have to understand, I have to explain to you why I'm giving you the medication, right? At the same time, I will explain to my patient why we need to do more than just the medication. Because one of the things I've noticed with our patient nowadays is just that when they come to me, they want medication and that's it.
Oh, yeah.
You know what? I cannot sleep, fix it now.
Right. Well, that's our culture. It's a westernized culture where we just do it. Like we want the easy way out. We don't want to feel pain. We want to be on that happy high that everybody sees on social media, that perfect 1 minute of, and that's all. Yeah. It's not truth though.
It's sad, like, though. It's sad.
It is.
It's sad. And I think, speaking of social, you just brought up social media. That's another issue again, right?
Yes.
Because when people are behind the monitor, they think that it can come. They just create those personalities easier than if they were sitting,
right,
across from us,
mm-hmm.
right?
Yeah.
So I feel that people need to really stop and understand that medication is not the answer for every single problem. Right?
Yeah.
One of the big issues that we're having right now, there's a big shortage for stimulant, Adderall. Why?
Yeah.
Because everybody is on Adderall. Yeah. Everybody has ADHD. All they have to do is go online, fill out some paper, 3, 4, 5 questions, or maybe 10 questions, and the next thing you know, they're diagnosed with ADHD.
Right.
However, when that patient sits in front of you and you're talking to them about their daily activities,
right.
you realize as they are doing their homework, they have the TV going, they have the computer going.
With a Mountain Dew.
Exactly.
With a Mountain Dew and a bowl of cereal.
Yeah.
Or a bowl of cereal.
Yeah.
I remember when I first started with ADHD over at the school. That's it. That's when I started realizing, right when I got out of school, I'm like, what did you have this morning? Captain Crunch and Mountain Dew. Mm-hmm. I'm going, this is why you're hopping all over the place, man. Mm-hmm. Like, I understand, like, and if you're being abused at home or emotionally neglected or, right, because your brain, okay, let's go into Dr. Amen now, Daniel Amen a little bit, because when I found him and he understood the holistic approach, because it's not about us saying no medicine. We're talking about medication has its place. It should be the last resort because medication has side effects.
It does.
And then it causes more issues. You might get help.
And we start treating the side effects.
Yes.
We get into polypharmacy, right?
Okay. No, let's go there then. Because Dr. Amen, like how he believes that, I think we had that conversation on brain health. It's an organ. Mm-hmm. Like we take care of the heart. We take care of the liver. We take care of the kidneys. Why are we not taking care of our brain?
Yeah. First of all, I do want to thank you for... I've been reading Dr. Amen's book. Mm-hmm. I've listened to him in the past, but never actually went to his clinic. So after I spoke with you, I actually went to his clinic.
Oh my gosh. I haven't even gotten out there yet. I will though.
I went, and now I actually refer patient out to them. Some of my patients who are not really doing well with the medication or whatever treatment I have them going on, and I've been able to refer them to Dr. Amen. So thank you for that. But holistic approach, right? Mm-hmm. So the thing is that just like you said, the brain is an organ, just like the liver is, just like the kidneys, right? Yeah. So if we're thinking that we can treat the liver and we can treat the kidney if that person is having kidney failure, or we put them on dialysis, right?
Right.
The same thing for the brain. There are chemical imbalance going on in there, and that needs to be treated. Right. Another thing, remember this, the brain has over 100 billion neurons.
Wow.
Think about that.
Yeah.
So if all of these things are working, or if one of them stop working, we don't know.
Right.
I mean, the behavior we're seeing could be the result of that, right? Yeah. What I like with Dr. Amen is that he's using those MRI that's actually able to...
Yeah, the SPECT scans.
The SPECT scan that's actually able to pinpoint and see why is this behavior like that? Why is this frontal lobe? We're seeing this and it's a frontal lobe issue, or it's a temporal, it's this, it's that. Right. I mean, I was fascinated. They actually took me to the room and I got to spend a good 1 hour there with them.
Oh, wow.
So it's really fascinating the work he's done. The work he's actually has been doing with NFL players. And that's one of the reasons I was so interested in going there, is because I had this contract where I was working with a lot of ex-NFL players that had to stop working because of TBI.
Yes.
So before they came to me, was a lot of medication being prescribed and nothing was happening. Right. They were getting tired of the medication. They were tired of the side effects and not seeing any change, any results. Real outcome, any results. So, and that's when I started reading more about Dr. Amen.
Right.
And then since then, I've transferred a few patients to Dr. Amen's clinic now. Yeah.
Wonderful. I saw some results with Dr. Amen, big time.
Yes.
I had a client that came in and spent some time in the mental ward of a hospital, young kid. It was a heartbreaking case, but the parents came to me and the thing is they weren't believers or anything. They just knew I was holistic and that, and they're like, it's my teenager. I need help. I'm like, okay. I did a lot of prayer. I'm like, what do I do? So I was like, okay, because when I don't want to say, they left the hospital with a lot of medication. Yep. And when they came into my office, they were really like, I'm like, oh my goodness. And spending 2 weeks there. Well, it turned out the trauma from being Baker acted caused the psychosis even more in a way. And then all that medication, the body was not used to all that. And so finally I was like, okay, you're going to go to Dr. Amen's and you're going to follow that protocol to a T. You're going to come see me every week. That kid is doing wonderfully now and will not. And then what happened was that client ended up smoking too much marijuana. The marijuana nowadays, there's a lot of marijuana psychosis in teenagers to a point where they're not understanding that it's that. Okay, they're going into psychosis, and because of the video games and staying up all night, and so you have this situation where you're smoking pot that you think it's not the pot that I grew up with, guys. I'm telling you,
not.
Okay,
it's not this
from
thing
the
that
70s.
They have now is being mixed with all kind of craziness,
right? Yeah. And it's so strong. The THC is so strong that these kids are like, it's just a little, and the parents and the adults around them thinking it's that too. So it's understanding like. You're putting this stuff in your system. You're not sleeping. You're playing, you're not going outside. There's no sunshine. There's no fresh air. And the next thing you know, you start getting paranoid.
Of course. There's no social interaction.
Right. There's no they think they're socially interacting on video games and stuff, which, I mean, there's a place, but when you're not, our body, God did not create our bodies to do what we're doing to it right now.
That's true.
And so, but back to Dr. Amen, thank God, like they started taking the supplements, the nutrition, going back outside. They detox from all electronics. They detox from everything. And then slowly Dr. Amen said, because I don't think we've spoken yet. So you're my go-to now because I'm not a psychiatrist. So anytime everyone's like, oh, I'm a medicine.
Let me just correct something quickly. I'm not a psychiatrist, right? Because I really want people to understand that there's a big difference between psychiatrist and psychiatric nurse practitioner.
Okay. Yeah. But you're able to handle.
We diagnose, we
prescriptions.
Prescribe. Oh, yeah.
And get people off prescriptions.
Of course.
Because I think I've sent you one or two, I don't know.
I've had a few
but it's understanding like they come to me and they're like, well, I don't want to take these meds anymore. I'm like, well, you need a doctor. Like you need someone that don't you just go cold turkey either.
And I do agree with that, Diana, because sometimes people come to me all the time. They go on my website and they see the word holistic and or whatever they read there, and they come to me thinking we can just take them off medication. It really doesn't work that easy. Just because it's holistic, that doesn't mean I'm against I'm against medication. That's not the case here. I'm just saying that medication has its place.
Yes.
You have some patients that come to you, they do need the medication.
Yes. And
some others, when you're listening to them and you're watching the behavior, you're like, well, we don't really need medication. You need a therapist. Right?
Like we all work together.
And exactly. And we work together. And it's when we work together, even studies have shown when patient is seeing it, on some type of medication or supplements and having therapy, the outcome is always better.
Right.
Instead of just doing one or the other, but depend on the level of the mental illness, right?
Yes.
The one thing I wanted to go back and say, when we're talking about the brain not existing outside of the body, maybe you're probably going to ask me that question later on, but I wanted to bring it now, how in the church we would pray for certain things, but when it comes to certain illnesses, physical illnesses, but when it comes to the brain, automatically people start thinking it's the devil.
Right.
they possess.
Yes.
You're this, you're
right.
that.
Or you're not
right?
praying enough.
Oh, you're not.
Your faith is not enough. You're not.
My goodness.
You're not reading your Bible enough. You're not praying enough, and that guilt and shame that's put on people, it causes more guilt and shame.
It does.
you know.
So, and I can tell you quickly on that. Speaking of the not praying enough, like I told you at the beginning, I was raised in the church, right? For most of my life, especially during my teenage year, I suffered with depression for a very long time.
Wow.
Right? Every single day during most of the days in my teenage year, I was thinking of harming myself. I was thinking of suicide, right? I couldn't tell my parents, but when I tried to tell my pastor, I was told that you need to pray more. You need to fast more, right? I was raised in a Pentecostal environment, so we would pray, all the prayer, all the fasting, all the midnight cries. If someone don't know what midnight cries is when we go to church on Friday night from 8 a.m. until the next morning, just praying the whole night.
Wow.
Singing and praising. Oh, yeah.
Okay.
And guess what? Even after all that, I was still suffering with depression. Nothing changed for me until when I came to the U.S. and I saw a patient. I had insurance by the time I was 19. I saw a doctor and I explained to the doctor what was happening. And he says, you have major depressive disorder. That doctor put me on an antidepressant and my life has never been the same.
Wow.
Right?
See, there you have it.
So we can pray, we can rebuke diabetes as much as we want. If you don't take your medication, you're going to start losing some toes and legs, right? If you don't take your medication for whether it's diabetes, whether it's hypertension, we know what can happen. It's the same thing for the mind. If you don't take that medication or supplement or whatever, or you don't do the things that your therapist want you to do.
Exactly. Right.
The outcome is not going to be favorable.
Right.
It's not a question of, you have to pray it out. Yes, you pray. Understand, I'm not saying that prayers don't have a place in
oh, no, prayers work.
Prayers work.
Yes,
Jesus is it.
Yes.
At the same time, Jesus has given us the knowledge to help our fellow men. Jesus is giving us the skills to use science so we can use our fellow men. You cannot explain science without God.
Exactly.
So I don't care what people say out there, right? But you cannot explain science without God. So science has been given to us so we can help others.
Exactly. That's what holistic is understanding, and I love saying this, the biology, the psychology, and the theology.
It is.
Putting it together and understanding that we're whole beings. So on that note, I think we're going, because I could, like I said, talk to you forever about so many things, but I did notice this Bible verse on your website when I was sniffing you out. And Proverbs 17:22. A joyful heart is good medicine.
It's good. Exactly.
But a crushed spirit dries up the bones.
Yeah, it is true. It is true, right?
That's beautiful. I mean, that's a beautiful proverb when you really think about that.
Exactly. Everything that there's another way to think of this verse is that whatever you think you are, that's what you are, right? So if you're thinking you are a positive, good person, then that's what you're going to start, your behavior going to start showing that.
That's neuroplasticity too, when you think about that.
Yeah. Your behavior going to start showing that. But if every single time you are thinking, just like, let me go back quickly into what I said when people were personalizing their diagnosis, going, my depression, as if they were owning the disease. Well, if you keep on thinking that my depression made me do this, then you're never going to, you're never going to be using properly the cognitive behavior therapy technique that your therapist is showing you or teaching you to help you so you can get better.
Exactly.
Right? One other verse that I love a lot is Proverbs, is it 18:21? That says, death and life are in the power of the tongue. We have to be careful of the things that we are saying to us.
Right.
I am this. After the word I am, because I am, as you and I know, it means God. Yes. So after the word I am, make sure there's always something positive coming after the I am.
Yes.
Right?
Yeah.
We do that a lot. Oh, I am so the S word.
Right.
I am so the D word.
I have to do a lot of that challenging in my practice because people come in like, oh, that was stupid. I'm like, why was it stupid?
Exactly.
Or, but I like that because I am means God. Like, and Jesus was the Word, right? I mean, John 1:1,
Yep.
right?
Yep.
And understanding like to be impeccable with your word is really important.
It's very important, especially for our mental health.
Right.
You cannot be really, describing yourself in such a negative way and not thinking that it's going to have some issues down the road. And the way you see yourself, other people will see you the same way.
It has to be balanced though, because we do have narcissists out there. And when they're sitting there, I'm this, I'm so good. And it's like you become your own God. So it's like balancing, understanding like you have the creator of the universe and we're here to glorify him and we have a purpose, right? Yeah. So I am fearfully and wonderfully made.
Amen.
Okay.
Amen.
All right. So on that note, Dr. Dorothy, thank you for coming.
Oh, my pleasure.
Where can someone find you?
Oh, they can easily find me on my website at www.peaceheartmindcare, or they can shorten it phmcare.com.
Okay.
Social media, the same thing, Peace and Heart Mind Care, Facebook, Instagram.
All right. I'll put all that in the show notes, and thank you for listening. And remember to trust in the Lord, guard your heart, and renew your mind. Bye. And now for the disclaimer to make sure you understand that you are responsible for you. The content provided on the Holistic Counselor podcast is for entertainment and informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified mental health provider with any questions you may have regarding a medical or mental condition. Never disregard professional medical advice or delay seeking it because of something you have heard on this podcast. The views expressed on this podcast are my personal opinions and do not represent the views of any professional organizations with which I am affiliated. Call your doctor, 911, or 988 immediately if you have a medical emergency. The Holistic Counselor podcast does not recommend or endorse any specific tests, physicians, products, procedures, opinions, or other information that may be mentioned on the podcast. Reliance on any information provided by the Holistic Counselor podcast, guests appearing on the podcast at the invitation of the Holistic Counselor podcast, or other listeners to the podcast is solely at your own risk. Confidentiality notice. If you engage with the Holistic Counselor podcast by commenting or posting and are a client, please be aware that you may be revealing information that could compromise your confidentiality. Please remember that disclosing your identity or personal details can be linked to your clinical material. As a therapist, I am bound by confidentiality and will not respond to any disclosures of this type on this podcast. I am committed to upholding the ethics and confidentiality of the therapeutic relationship, which extends to all forms of communication in accordance with the laws and professional guidelines that govern mental health professionals. I want you to know that your privacy is of utmost importance, and you are responsible for protecting it when interacting on this platform or any other public forum. Thank you.